I started presenting these $8,000 care plans, which I had never done before. I had zero idea. Luckily, we had all of your resources because those were just so valuable for us because I couldn't have come up with my own stuff. But I started presenting these $8,000 care plans and people were saying yes. And I think at first I was taken aback that this was all cash, out of pocket, and people are saying yes to this. And just in the last 3 weeks, I presented like 7 in a row and every single person took care. And it's been so cool to watch my staff step up because...
Welcome everybody to In the Blue. This is the April broadcast for the March edition. And as you guys know, we've got some amazing doctors to share with you who have killed it with building momentum in their practice and really recruiting their team and getting them on board with not only the data-driven systems, but their leadership and their uniqueness that they're bringing. And we're so excited for them to come on here and share with you some of the things that they have done to build that momentum. And as we go through that, please comment in the Facebook group. This is an opportunity for you guys to actually drop questions, anything like that inside the group that we can share with you guys to help you build your same momentum. We'd love to see you on this broadcast next month as you hit your In the Blue opportunities. As you guys know, the concept of In the Blue really came from when I decided to name Blue IQ. Melissa and I were actually laying on the beach in Florida. We were on a spring break with the kids, and we were just talking about, hey, what are we going to call the software? And as we were kind of go through, I said, I really want to have something represent the performance and then something represent the skill sets, the mindset, the thing that really drives the performance. And so as I was looking up at the sky, blue, being at a level of performance, right? Not just being in the black, but being in the blue. And that actually was the name of my first book that I published called In the Blue. Maybe some of you have read that. And that concept of really IQ, this is the IQ of that, right? Bringing the wisdom of the community, not just my experience. We're bringing incredible wisdom from all these doctors to share with you of how to get your practice in the blue and break through these new records. Before I introduce our guests here, just real quick heads up for those of you that are joining us in Salt Lake City in 2 weeks. We can't wait to see you in person. As most of you know now, we are moving 2 blocks to the east of where the original event was because we needed bigger space. I wasn't sure how many of you would buy tickets to this event knowing it was more clinical and not as much business-driven systems, but it's going to be incredible with the clinical training and now the sales training that we're going to be doing at this event. It's going to be incredible. And I just want to thank you from the bottom of my heart for signing up, for showing up, for being there in 2 weeks. We had to get a bigger venue. We didn't have a big enough room that we originally booked, and the hotel didn't have any more space for us. So if you're staying at the Sheraton, it's totally fine. It's only a 2 block walk to get over to the Grand America. If you don't want to stay there and you want to look at space, the Grand America is sold out, but the sister hotel right next to it called Little America, they do still have some room. So you certainly can move over there. Not a big deal. And that's literally right across the street from the Grand America. So super excited to see you all there. And it's going to be one of our best events. I'm really excited. It's not a Driven Doc Live, so don't come with quite the expectations of a Driven Doc Live as far as the production, but the content is going to be out of this world. So without further ado, I am so excited to share with you now our guests. We have Dr. Robert Schuck, we have Jeremy and Amelia Rodrock, and Omar Clark on here. All of them have crushed their numbers in the last while, but particularly we highlighted them in March for their In the Blue. All of them record collection months, and we get to find out how they did it. So if you don't mind jumping in, I'm going to start with you, Robert, if that's okay. Just if you don't mind just sharing with us, like, what have you been doing? And I know you've been navigating a lot of things with Robert actually has ownership in multiple locations. And what's changed? Like, what are the things that you guys are doing that's helped you get into the bloom?
So we scaled, and then I don't know that we had the structure that we needed. So the things that, and it's taken a long time. I joined DDP April of last year, so it's a full year of work, and then also the work that you put in as a visionary needs to be implemented by the rest of the team. And some of that team wasn't the right team. Some of that team knew they weren't the right team and changed themselves. But for me, finally getting those people in place and then our meeting cadences, uh, plugging the holes is really all I've done. I don't think I've even scratched the surface as far as some of the niche marketing, niche things like that. But just shoring up what we have, because we grew without a lot of structure. And now I was able to use DDP's structure model and put people in the right place, reassign things to the right people, track those things, take action upon the things that we're tracking. And it finally started to click. It started to click with not only me or our new office manager, but on down the way.
That is amazing. Amazing. I love what you said, right? You scaled before you really had structure, and that's like trying to build the frame of a house before you put the foundation in place, right? And I see that mistake with a lot of doctors out there, and that's you get excited, people are loving your service, the transformation they're getting in your practice, but we don't always have the right people and the right seats or the right organizational structure. And so that's amazing. Just getting that in place sounds like it really transformed your practice. If you looked upstream at some of the metrics that had some of the biggest impact that led to the downstream collection growth, is there a particular metric? Was it kept appointment percentage for established patients? Was it new patients? Was it starts? Like, what did the data tell you?
Ours is our case value. We were really relying upon what insurance pays us, which gets lower and lower every year and will continue to. So we added cash services and then started implementing that with every new start. So
Nice.
like I said, we're not all the way into the niche stuff yet, but doing these starts correctly and including some of the cash valued services, just getting our case value up has been the biggest thing for us.
Yeah, and again, I have found some docs, I would say in the profession, looking into the DDP, or even some of the members that have come to the DDP feel this pressure that they have to dive into these specific niche services. Uh, it makes marketing easier. It definitely helps you establish your authority easier, but uh, in reality, it's really care planning. And it's taking what you've said, not being so reliant on insurance and looking at how do we deliver a better care plan with clear outcomes, which we're going to be talking a lot about in Salt Lake City at this event coming up. How do we properly care plan? How do we build a treatment plan that gets those services delivering to a patient that creates the transformation? What do you mind if we ask what specific cash services did you add?
So in July of last year, we added 3 of the back on tracks. So in each clinic, we put 3 decompression units in, and then then we added laser in September, and then I added a shockwave to our main location in December. So
Oh, incredible.
yep.
Yeah,
So
talk about building out your repertoire for being able to now establish yourself as an expert in those areas. Because with those 3 pieces, you can really add that to a care plan to get some incredible results. And I love it. I love it.
yep.
Any pearls of wisdom for newer members as they're coming into the DDP? You're now a year into this. What would you have told yourself a year ago to kind of help you implement maybe even faster or even get better results?
I think in a lot of encouragement from others, Jeremy Rodrock is really good. So you'll hear from him later. Amelia too, she knows it. So for me, that 20% rule where you got to get some of it going, and then you just need to move. You need to just move forward. It's really hard. You feel like you got to sit in the garage and make it be perfect before you take it out, and you'll just sit in the garage if you don't. So for me, it was getting myself to just not be super comfortable with what we have, but then proving that we're better than we thought once we start. So
Yeah. So good. So good. So as we were saying earlier, imperfect action is better than no action.
right.
Don't let perfectionism turn you into a procrastinator, because again, we want to get great results for our patients. But like you said, if you just start with the new patients coming in and they don't know what your care plans necessarily were before. Uh, as you start in that transition and you start implementing and using those first few patients that come through with your new care plan as case studies, that's really where you start moving in that direction. Was that easy to get your team on board with the new kind of care plan presentations and delivery systems? Was that easy?
No, especially insurance based. They're used to presenting a $400 or $500 out of pocket case plan for a short treatment plan. Well, if we're trying to correct something, it's going to take more money, it's going to take more effort, it's going to take more time for the patient, and then we haven't we haven't even started looking for those patients who were looking for that. We're just using the patients that we have, and then not forcing them into, but only giving them the options that we think are going to be best for them, regardless of whether insurance pays or not. Like, we just can't worry about how much that's going to be for them.
Yep.
We have solutions for it, but we're not going to avoid what we say to the patient based on what their insurance covers.
So good. So good. It is a challenge. So in this community, I really want our driven docs to know. I remember that. I remember shifting from a more insurance-based model to that same thing. And I remember sitting down with the team and laying it out, really kind of showing them what a care plan looks like, what the phases of care look like. And I wasn't even very good at it back then, but it was enough to where it clicked for them. And if somebody was going to invest in their health, it really was this mindset of, yeah, you could access what your insurance is going to provide, but then you're going to get this much change, versus commit to this level of health, commit to this outcome that can be accessed if you invest in yourself. And I think once they got that, and then they saw the actual results of these patient transformation changes, like you, it was just like, all right, we're all in. And some of them weren't. So I think that's a big thing we all kind of go through as we begin implementing accountability. We start implementing structure. B and C, well, B players typically rise, C players exit. They self-exit. That's pretty common. We see that a lot, and that's not a bad thing, right? That's actually a really good thing for new opportunity for those new team members to come in. So are those new team members coming on board and really jumping all in?
Yeah. And, that's another thing with the DDP stuff, having a plan to onboard that staff member. Training was so important. A lot of our mistakes, if you will, from the years before were front desk, just entering a patient correctly, how to do the things. So we only handle it once. We have that mnemonic, only handle it once, with insurance. So, like, that was where a lot of our stuff was. So, getting the right office manager who knows ChiroTouch inside and out, and then having an onboarding process, actually, rather than just throw them in first day and kind of show them a few things and let them start answering the phone is way, way more important. So,
yeah, so good. Love that. Rodrocks, Omar, any questions for Robert? Okay.
I think so.
Great job, Robert. Thanks so much for sharing. And you can jump in and ask these other driven docs any questions as we go through them. Let's go to the Rodrocks. The Rodrocks also have only been in the DDP for just over a year. They were only a few months ahead of you, Robert. They came into the OIC instead of just coming into evolution, but still that was a lot. And I know they they've expressed that to me as they've gone through this transition. But you're here, like share some of the percentages of growth, if you guys don't mind, from last quarter of 2024 and this quarter of 2025. Do you guys mind sharing just some percentages of growth?
Probably know that.
Well, I'd say if I'm speaking for Amelia, she's probably at 100% growth or more.
Wow.
And
It's a double.
yeah,
At least.
at least. And I'll let her share some of her big wins here recently. But, we're probably a 50 to 60% growth from last year, first quarter, which we were moving up last year, first quarter to start with, because we had implemented SoftWave into our office, which was helping. We just didn't exactly know how to utilize it to the max and how to, integrate it into our current care plans and things like that. We were just using it more as a therapy instead of actually, one of our processes of helping someone heal.
Yeah. Yeah, that makes total sense. And you guys were pretty straight chiro, kind of more high volume. I think you and Robert were running similar, models. And so as you've kind of come in and learned some of the systems of DDP, what's been some of the mindset shifts that you guys have gone through that have gotten you to where you're at?
Well, that change is important. That's the biggest mindset, not being stuck in this way that's been working. But I saw things happening, with my body, basically with that high volume, and I still wanted to care for people and doing what I love to do. But I needed a new answer to do that, and was ready. I thought I was ready for that change, but that was probably the biggest difficulty of doing something for 22 years the same way and trying to get those new neural pathways to do something different was definitely a challenge. But once I got past that mindset of, and then again, not being perfect, because everything was so comfortable, our office ran like a well-oiled machine. I mean,
Yeah.
we could handle about anything. So adding something new, it was a challenge it's like, it's not that difficult to do this, but when you're just in such a rhythm for so long. But once we got past that and just got a couple wins under our belt, just the momentum started building.
And it wasn't as hard for me, I don't feel like. I was ready for change. I'd never really wanted to be stuck in the just chiro, because I knew I wanted to get out of it someday, or, not be stuck in my office. But I didn't know what that looked like or how I was going to achieve that with the current model. So I was ready for some change and to do something different.
Yeah. And just so our community knows, two separate offices. They each have their own location. They each have their own team. They're driving their own models. And I remember when I was making the transition from operator moving to leader, and then eventually high performer, where I wanted to scale down my patient care time, but kind of feeling guilty. I remember feeling that guilt that my patients were demanding it. So therefore, right, because I'm a pleaser, I want to make people happy. And it was brutal having those conversations with especially my really loyal long-term patients. How did you guys deal with that and making this transition?
Well, still working on that for sure. But an interesting thing is I've definitely scaled my volume back. And then as we've got all this momentum, my volume has hugely jumped again. But I am passing a lot of that on to my associate, which has been nice. And gaining that trust with him and I has made the biggest difference. I think that's a thing. I wanted to make sure my patients were very well taken care of. And, I wasn't doing the best of job with, like Dr. Schuck was saying, training. And once I just re-onboarded him, basically, and we went through things, oh my gosh, it's been great.
This is interesting because we talk about the associate value ladder and your relationship with your associate in our very first discussion compared to your relationship with your associate now, little different. How has that framework that the DDP provides helped you build clarity and better strategy within your business?
I mean, it's been a game changer. And just having, I didn't do a good job with communicating with him like I should have, even though I thought we were. We had some processes, but having our meeting cadence has made all the difference. And I think he feels more involved and an asset to our practice rather than, he's just taking care of people. He's actually contributing to the practice in a different way, which I think mind shift for him has brought something out in.
Yeah, that's incredible. I talk about unlocking potential, just by better communication, better clarity, better vision, all of those things. Amelia, this has been an amazing transition for you, going from a walk-in clinic basically to now care plans, from spine and disc to neuropathy that you've implemented in the last this year. What's that transition, and tell us some of the numbers that you're hitting.
So yeah, we've always been kind of I mean, we did a little bit of care planning, but it was all straight chiro. I mean, $1,500 or less cases, nothing, insurance based, like, Rob, what is your insurance going to pay? What are they going to do? And so when we joined DDP, we started kind of focusing on spine and disc because we got soft wave first and then we got decompression. So it seemed like a natural transition. And it's something that we're familiar with anyways. We've done spine and disc, which spine and disc was good, but then we decided we were going to implement neuropathy because I felt like I would have a little more potential with neuropathy because there's just not a lot of solutions for neuropathy. And there's a lot of more solutions and options for spine and disc. So I wanted to kind of test out neuropathy, and we just kind of jumped into the deep end and just went forward. We had our first seminar, and it was phenomenal, just with our own patient base. I think our first 3 seminars were just with our own patient base. And I started presenting these $8,000 care plans, which I had never done before. I had zero idea. Luckily, we had all of your resources because those were just so valuable for us because I couldn't have come up with my own stuff. But I started presenting these $8,000 care plans, and people were saying yes. And I think at first I was taken aback that this was all cash and out of pocket, and people are saying yes to this. And I mean, just in the last 3 weeks, I presented like 7 in a row, and every single person took care. And it's been so cool to watch my staff step up because one of them we hired right when we joined DDP. So she was kind of in this weird transition period where we're still doing it the old way, but we're trying to transition to the new way. So it was kind of confusing for her. Yeah. But my case manager, she was kind of a B player for a long time. But boy, I feel like since we implemented neuropathy and I've given her so much more responsibility, she's just stepped up to one of the most valuable people in my practice. And it's been really fun to watch her grow. And I tell her all the time how great she's doing. And it's great because she's getting a great bonus. And, it's changing her as well. But I just had to give myself permission and have confidence. And, I still get a little down on myself when someone says no, but boy, people used to say no to my, $1,000 care plans. It's okay. It's okay. But it's just been, so life-changing for my office and for my staff and for my community, really.
Yeah, because you're now providing a resource that wasn't available in your community before. And what a gift that is to the community. And if you wouldn't have made the mindset shift, if you wouldn't have, decided to go all in on this, think about all of those lives that wouldn't be getting the results that you're now getting them. Yeah. That's phenomenal. What's a pearl of wisdom or something that you would share with yourself a year ago, right? Jumping into all of this that maybe would have helped you and obviously helped our new members as they're navigating now all of the stuff that you've now done over this last year.
I think just take it one day at a time. You get flooded with so much information, and I would be focused on one thing and then hear something. And I was like, oh, that is awesome. I want to start that. And then this would get pushed to the side. And just, that was a continuous thing. And then pretty soon we're not getting anywhere. So it's like, start and just jump in and just go instead of, again, trying to reach perfection or do it all at once because it was such a big shift.
Yeah. Yeah. It sounds like the prime mover, right?
Yep, exactly.
Find that one thing.
Yeah. And when we started doing that, that made a big difference. And we could just focus on that and then use little things from the systems to start gaining momentum to get towards that goal.
Yeah, I got to give a big shout out to your team too, because you've invested in them, right? You've brought them to OIC events. You've really made sure that they're on the Tuesday evolution calls. They're actually engaging. They're not. It's not like you're filtering and then disseminating. You're bringing them to the source so that they get trained and can immediately go and implement. Have you seen a big, maybe a faster adoption from them by doing that?
Yeah. And my staff, I mean, my longest staff's been with me 16 years and the other one 12. But they did jump right in. I mean, there were some challenges. We had some hot moments at times because I was expecting a lot, which I like that they, push back just a little because I recognized that because they were on board, I just needed to definitely train them more, and I was able to recognize that. So,
yeah, 100%. I love it. I love it. Robert, Omar, any questions for the Rodrocks? Anything that you want to know from them that we haven't?
Well, I have one. Amelia, you guys again, very inspirational, both of you, about how you can do what is hard for me, and that is just take a leap and start doing stuff, implementing things. But Amelia, you had a post about your first neuropathy after, like your after re-exam, and were you nervous?
Very nervous.
And then,
oh my gosh, yes.
How have the other ones come back since?
So yes, I was very nervous because if I didn't show any change on something, I was like, oh my God, is this the right thing? Is this going to work? And when we took his thermal imaging and it was like 100% normal, I almost started crying. I was so excited. And then his wife came in because he had texted her. So she came in because she wanted to see him. So our whole office was like, I feel like after our first re-exam, that's when the big shift happened because now my staff sees, like we have the testimonials from the other offices, but we didn't have anything from our office. So now that they've seen that, like they see what we're doing, it's really making a difference. And everything since then has come back great. Jeremy, you've done a handful, like everybody is showing a lot of change, and it's really exciting to see these people's lives be changed. And yeah, the difference that it's making.
I had a question. Well, first off, kudos to all the accomplishments, but something that you all stated that really stood out to me, and hopefully everyone else heard that, as you said, your longest 10-year staff was 16 to 12 years, 12 years and 16 years. I think that's huge. One, I want to say that's awesome to even hear that, but it also speaks to you all's leadership. So my question in regards to that is, what have you all done over the years to, keep that vision fresh within their mind, and then also creative ways for them to continue to grow, to have staff it's been there for roughly 16 years? Yeah, I think that's awesome. So I just want to hear your feedback of just keeping the team motivated, keeping them on par with the mission and your vision as well.
Well, big thing, my accountant said to me once, my gosh, you spend a lot of money on education and traffic. Yeah. We've always included our staff in continuing education and taking them on to data-driven live and stuff like that. And they get fired up for it. They're ready to go. They do all the planning. I don't have to do anything. It's like they get the hotel rooms, book the flights, they're ready. So I think that's a big one. And then we've always just really valued our staff. And I've even seen it more now, when a staff has gone on vacation and stuff like that, how much I appreciate them. And we always let them know that. Try to always keep them as part of the team and decision-making in our office.
Yeah.
No, I think that's awesome because, the saying is, your team and your assets, right? Individuals, those are your assets. So I think that's amazing to have someone 16 years. Yeah.
Yeah, I loved how Amelia threw in there that, they're closing these $8,000 care plans, but now her team is bonusing and using the driven operating system and the bonus framework really helps with that, right? Helps them feel valued, helps them see the incentive of implementing something like this and putting in the work to make that transition. So great job, Rose.
Yeah, no, one more big thing, Omar, I do appreciate all your help. And that's another thing I suggest for any new doctor is, find a mentor in the group. And, that was when we first joined, I was like, what are these docs going to be like, and not to be snobby or anything. You don't know. And man, doc's been amazing and just reaching out and everyone's so helpful and generous with information. That's been a big game changer too, and the support.
Yeah, I was going to say that, Amelia, she read the neuropathy prime provider track when she left last April in Florida at the Driven Doc Live event. But, implementing neuropathy wasn't just simply reading a book and then all of a sudden going and implementing, right? She worked with her coach. She talked with the different members in the circles. She gleaned from all of that to really help her fully take action in implementing this. So I agree with you guys. I try to say it as much as I can that the value of this group are the doctors. It's the community that allows you to really, feel supported.
Yeah. No, I have to agree. And it's also too making sure people take advantage of the community. Right. I always emphasize you never want to be on a lone island. It's individuals. There's some amazing docs out here within this group, and you just have to reach out. And I guarantee you, if someone's thinking about it, if you're thinking about it, someone else is thinking about it, already went through that issue. So yeah, definitely take advantage of the docs.
Yeah. So good. Well, Omar, that brings us to you, brother. This has been a wild year for you and Jets this last year. They have built a brand new building that's absolutely gorgeous. I wish so bad I could have been there for the ribbon cutting ceremony, but I love the social media coverage and everything that you guys have done. It's been a growth year as you've now learned how to really project manage, everything from building to transitioning into a new building and changing your approach and all of that. How did you do all of that and come out of this now with record-breaking collection months?
Yeah, well, a couple different reasons. Obviously, my wife.
She is a rock star.
Yeah, she's my rock star. But the biggest thing is kind of like the book that we just read. Who, not how. And then delegating and really maximize. There it is, right there. Who, not how. It was a great book. Really transformational book. It actually helped me in a lot of different areas. But the main thing is just mapping things out, having systems in place, delegating to the right individuals, and then also understanding what this season was going to be like and pre-framing it as well. Granted, some people don't like change amongst the team. However, that's okay, especially with just having these different systems in place. So now, yes, we got into our new space in January and I already had everything kind of mapped out, Jasmine and I, and now we're hitting the ground running. I just actually hired 2 more docs. One of my docs didn't want to deal with some of the change, and that's okay. With CBP, I'm integrating some different things, but I just hired 2 more docs. So it's going to be 4 of us now in the office. And, and I'm a numbers guy, so I brought some data for us, for Dr. Corey.
Love it. I love it.
So a couple different things too. We knew in 2024, in quarter 4, what we need to focus on from a prime mover aspect. So that's when we focused on our case acceptance. So in quarter 4, it was only 57%. So our goal was quarter 1, we want to focus on case acceptance, and we got it up now to 65%, so an increase by 8%. And then in also quarter 4, we were also looking into profs, just our, when we sit down our 90-day review, and that was at 71%. So we've kind of had a little bit of a focus on that as well. And now we're up to 84% in quarter 1. So those are some of the different things that, we already knew. Even though going through this building project that, it kind of hurt us because my mindset, we went to 100% focus on the office, but we had things in place that once we step foot in that building, we're going to hit the ground running. And now you're starting to see the fruit of that labor, and that mindset and the planning, which has led to us of, I also broke down the numbers. For January, we saw 59 new patients. February, we saw 70. And then in March, we saw 67. So at Q1, we've seen 196 new patients already.
That's incredible. Great job. And that's what we say, right? Doctors who know their numbers can grow their numbers. And being able to implement the driven operating system, data, knowing those numbers, who's responsible for those numbers. And then that third piece that you guys have talked a lot about today is that focus, ignite, right? Igniting with the prime mover. Too many of, I think, our members, especially in the beginning, feel like they do have to implement everything at once, or they try to make too many changes. And that can definitely break down an organization. And so here's a practice like yours, Omar, very large staff, this big, new, beautiful building, a lot of moving parts, but you hear him focusing on the one thing. And way to go, man. You see the fruits of those labors, and just incredible momentum that you guys are building going into this next year.
I appreciate that. And when you were talking about reaching out to docs, so something else that my wife spearheaded, she reached out to the Landrys and the Logans and picked their brain on some of the systems with the virtual assistants. And so my wife created a whole training platform aspect, and we hired some virtual assistants. And in the Philippines, they have their check-in calls, their Zoom training calls, role playing. We actually had them review some of the modules as well. And now they're averaging roughly 100 calls a day on all lead follow-up. So that's been a game changer as well, just by tapping into now lead follow-up, on top of leveraging some other docs to pick their brain on how can we, increase efficiency with our leads. Yeah. So now that's just helping us down the pipeline. But the main thing is we're excited. We're definitely already on pace for a record month in April.
Thanks.
And, I will say this, I had some docs shadow, and they were just astonished by the dashboard. So when they were looking at it, actually at our meeting, and we were going over our KPIs and breaking everything down, they said, I've never heard of anything like this in school, or even out of school or somewhere out. So I think it is very important just to, understand your numbers, know how to make decisions based on your data, because that's something I will say. Before I got involved with DDP, roughly DDP 4 years, OIC 2 years, I used to make certain decisions, but it was based on emotions. It wasn't based on concrete data. So now, Jasmine would say, it doesn't matter what you feel. What does the numbers show? And I'm like, oh, you're right, hon. It's all about the numbers.
I love it. That's right. The numbers start the story, and then we just work through it with the team, and we just become like a clinician, right? We're just investigating. We're curious. Be curious about the data with your team. Have those conversations. It's not blaming. It's not accusing. It's just trying to have a conversation as we together, right? Investigate the data. We look upstream. We identify the process. And that's where you guys did a great job, Omar, is identifying the constraint, right? With lead follow-up. And that's a big constraint for a lot of practices. And so to see that conversion, to see those new patients, to see the quality improve, it's awesome. I'm really excited for some of the exercises we're going to be doing in Salt Lake City. The OIC is coming a day before, and we're going to go through some of that. It's going to be fun to now kind of look at that next phase of growth that you guys can continue that momentum and build our healthcare empires, because that's what Driven Docs do. Amazing. Well, any last pearls of wisdom for our community before we wrap up our live stream here?
I would say, something I was just at last, I forget, I don't even know what call it was, or the business conference. They were just talking about leadership requires capacity. And then without capacity, you won't have the capacity to get where you're trying to lead. So just having an understanding, but then also that ties into don't be afraid of change. More so of, use change not as a setback, but a setup for growth if you're trying to implement these systems. And then the biggest thing is not to manage change, but be the leader of change. I can definitely say, if you have that mantra, if you have that understanding, no matter, when you're trying to implement these systems, if you lead the change, your team will either follow, or guess what? The right people will get off the bus. The wrong people get off the bus, and the right people will come on the bus. Because that's one thing that did happen, a little bit in the beginning, when we were implementing these systems. However, just think about it setting you up for growth, and then also just lead and navigate through that change versus manage that change.
I love that. I love that because it's not like nobody should come into this expecting it to be easy. You heard from Omar, he's been doing this for 4 years, that him and Jasmine have been literally breaking every piece down and retooling it, building it line upon line. And now, Omar has this beautiful mansion that they have that wasn't built overnight. And so don't get frustrated. Don't think that, 1 year in, I don't have what Omar has yet, that you're slow or you're dumb or you're driven. You are a driven doc. You've made the decision to move from drifting to driven. And we cannot fight the mental insanity that's happening in the world of healthcare out there through pharmaceuticals and traditional medical models without more of you getting in the blue so that you guys can continue to spread your influence, doing exactly what Amelia is doing, offering now true healthcare to communities that is literally life-changing for those communities. So thank you so much for being here, guys. Thanks for taking the time, just gifting this incredible insights to our community. And we wish you to have as many in the blue months in your future. And we'll bring you back as you hit those, and hopefully other docs. This is why it's important to share in your Driven Doc circles. This is why it's important to share on the evolution calls. Share with us how you're hitting those numbers so that we can bring you on and you can share with the community what steps you've done to implement to get this momentum. Have an amazing Friday. We will see you guys in 2 weeks. 2 weeks in Salt Lake City for an amazing, amazing conference, right? Clinical Closing Mastery, Prime Provider Track, Spine and Disc. It's going to be a game changer. You're going to learn sales techniques that I have not taught. I don't have, these are advanced. I've upgraded them from what's in the exam and case acceptance site. I can't wait to share those with you 2 weeks from now. Okay, guys, have an amazing day. Thanks for being here.
Thank you.
Thanks.